Welcome. Thank you for joining our Manufacturing Practice Best Practice Series webinar. I'm Becky Melody, your hostess for today's presentation. The discussion today will cover introductions, webinar logistics, direction for post-webinar collaboration, and our discussion topic, Show Me Your Product ID, ePedigree, and Serialization. We have two tremendous presenters today. John Denise is the Product Strategy Director for Oracle. He offers 20-plus years experience in life sciences manufacturing and supply chain. Jim Kerr, USDM Senior Director, Oracle Life Sciences, is our second presenter. Jim is the North American Chairperson of OAUG, Tutor User Productivity Kit and Technology Adoption Special Interest Group. Jim's an industry speaker on ERP computer validation, Part 11 assessment of ERP. Jim has been a featured speaker 9 times at Oracle Collaborate, the conference, and Oracle Open World Conference. U.S. data management is focused exclusively on the life science domain. We're the market leader in providing IT, quality, and regulatory compliance professional service solutions. We're headquartered in Ventura, California, and we're the only West Coast VMware provider and partnering with qualification expertise. We've been trained by experts in the industry. We've delivered more than 1,000 successful projects with over 150 life science clients. We're a preferred partner, a compliance partner for small, mid-tier, and large life science companies. We specialize in assisting clients with reducing regulatory risk while maximizing their investment in quality systems, as well as ECM, laboratory instruments and systems, and IT infrastructure. Our directive is to simplify, unify, and optimize compliance and business objectives. The content will be covered in approximately 30 minutes, and then we'll invite you to post questions for our team via the iLink message board on the left of your screen. We'll address questions following the presentation, or if your question is of a confidential nature, feel free to send an email following the presentation, and our contact information will be provided at the end of the session. We are happy to address any questions offline. Thank you again for taking the time to join us, and now I'll turn the presentation over to John.
Okay, thank you very much. Thank you everyone for getting on the call today. Today we'll go through, I'll cover the drivers for change. So basically what's driving serialization and product tracking in the pharmaceutical industry as well as in the medical device industry. And then I'll introduce briefly Oracle solutions in this area that can help you comply with these evolving regulations and business needs. Then I'll hand it off to Jim Kerr, who will talk through U.S. Data Management's validation offerings, and he'll actually go into a bit more detail and show you some screenshots of Oracle's Pedigree and Serialization Manager solution. And as Rebecca said, we'll open up for questions and answers at the end. Most of the things that I will hear that are related to product are things that are generally available today. However, we do need to put up the safe harbor statement because there are a few things, and I will let you know which things are not currently available that are production roadmap items for the product, but I will clearly let you know what those things are. So those of us that are focused on the evolving global regulations in the life sciences industries know that counterfeit drugs are getting a lot of press in the past few years. Recently, the Department of Homeland Security's Immigration and Customs Enforcement Team, or ICE, has ramped up its crackdown on counterfeits and intellectual property theft crimes as well. It isn't widely known before, know it now that counterfeit products are all around us. Mostly at risk are consumer products that are sold like cheap knockoffs of the real thing. For instance, we're all familiar with cheap Gucci bags or imitation Rolex watches that are sold at ridiculously low prices on the streets of many large cities. any reasonably educated consumer knows, or at least has a pretty healthy suspicion, that these are not made by the real brand owner. But because they can often pass them off as the real thing at a distance, these counterfeit products or knockoff products are generally good enough to satisfy our needs and wants, and we're willing to play a willing role in the propagation of these illicit goods. Far and away, as you see here, footwear is the most counterfeited product in the market, followed by other consumer goods, with pharmaceutical a bit down the list in terms of volume. The development of Oracle's solution in this area, Oracle Pedigree and Serialization Manager, has been driven by developments in the pharmaceutical industry as well as the medical device industry, which are intended to fight counterfeits and other issues with knockoff products. So why do we focus on pharma and specifically medical products? Well, counterfeit medical products pose a threat to the public's health and safety, which most other types of illicit goods do not. And I'll explain a little bit more shortly. Counterfeit medical products are a worldwide problem, although it's often thought of as mainly a problem in the developing world, where it's estimated that anywhere from 10 to 30%, you may have heard these figures before, of the drugs that are purchased in the developing world may be counterfeit. In developed countries, it's also a significant problem, with some estimates putting counterfeits in the U.S. market at about 1%. Now, this doesn't sound like a lot, but it's significant considering that over 4 billion doses of prescription pharmaceuticals are administered in the U.S. every year. So over 40 million could be counterfeits. And recently, if you watch the news clippings online, there have been a number of counterfeit events in the U.S. as well. The fake products, which are often very difficult to discern from the real thing, can be hugely harmful because there's no guarantee that they have the correct active ingredient or the correct potency, or were manufactured under any type of regulated environment. So the unwitting consumer may not be getting the medicine that they need to treat their illness. They might be getting it in the wrong dosage, or might be getting an entirely different drug that might have harmful or deadly side effects. In addition to bringing harm to the consumer, the manufacturer's valuable brand is often harmed, and revenues are lost as well. In addition to the counterfeit threat, drug supply chain security is also at risk from thefts. And here is just up at the top here, just a few of the heists that have hit large pharmaceutical companies recently. And you can find more on the FDA's cargo theft page, where there are listings of dozens of pharmaceutical and medical device theft incidents. Although not the most widely stolen type of products, that honor went to food and beverage in 2010, pharmaceuticals are tempting targets for thieves because they're small, very high value, and promise huge payback because there's a fertile market of people looking for ways to cut the high cost of their medications. Pharmaceutical thefts registered the highest per incident value of all product thefts at almost 3.8 or almost $4 million per incident. And that's compared to an average of about $470,000 per incident across all industries. So thieves seem to like that 8x risk reward ratio. So if I were a thief, that's something that I would be drawn to as well. Of course, they don't care about the risk that their actions impart on the public. Recent cases of these stolen drugs being diverted back into the legitimate supply chain domestically and internationally have been reported multiple times. And these thefts introduce risk to public health and safety because once they're stolen, there's no longer any assurance that the drugs have been properly handled in terms of storage conditions or shelf life management. And they also could be commingled in bulk with knockoff drugs or drugs that have no active ingredient in it. So sometimes they do that. They take stolen drugs that are legitimate and mix them with sugar pills or other counterfeit drugs that don't have the efficacy of the actual product. So in addition to the cost of the stolen product, the manufacturer generally has to recall the entire lot of product, even the portion that hasn't been stolen, because they only track the product at the lot level today. And I bring this all up because this is another area where mass serialization can help by providing the ability to do more targeted recalls, by decommissioning only the serial numbers that were stolen and allowing the unaffected portion of the lot to be distributed, as long as they're identified at the serial level. To combat the problems of drug counterfeiting, theft, and also to better track reimbursements, governments around the world are in various stages of enacting regulations that standardize codified identification of pharmaceutical products, and in many cases requiring unit-level marking to identify the number or serialize each sales pack. And this timeline here provides insight into the scope and timing of many of these global regulations. And as you see, there are a number of countries which have enacted regulations already. However, there's a lot of attention being paid to the largest markets of the European Union and the United States coming online with product codification and unit-level serialization requirements over the next few years. And on the next slide, I'll give you a quick update on some of these regulations. So starting with the U.S., in the U.S., 30 states already have pedigree legislation in various stages of approval, with Florida probably being the most prominently recognized. California has made the biggest splash, however, because of three fundamental differences with their law compared to other state laws. First, whereas other states' rules require pedigrees to be initiated by the distributor, and noting that some states exclude the authorized distributors of records, or the ADRs, from the pedigree requirements, California requires the pedigree to be initiated by the manufacturer or the brand owner. Secondly, and probably most significantly, California is the first state to require unique identification or serialization of product packages down to the pharmacy saleable unit. And third, California is requiring the pedigree to be in electronic form. They have not and probably will not specify a standard, but the GS1 drug pedigree messaging standard is currently the only standard that would address the California requirements. But note that GS1 has a work group currently active working on modifications to their EPCIS standard that is intended to make it a suitable means to address the California requirements as well. Even though there have been several highly publicized delays in California, it's likely they will not delay beyond 2015 when their phased enforcement is slated to begin for 50% of the manufacturer's products. The remaining 50% will require serialization and pedigree in 2016, when the distributors also have to be able to receive, update, and send pedigrees, and wrapping up in middle of 2017, when the requirement to be able to receive pedigrees falls to the pharmacies as well. An important piece of the California law is a clear statement that they would defer to any federal regulatory action which serves to address the same need. And we've seen an increased activity at the federal level, indicating that they're seriously considering action as well. Some of the indications we've seen are the Serialized Numeric Identifier, or SNI, guidance, which is a recommended serialization approach back in March of last year. The Obama administration's July 2010 proposal calling for drug track and trace and pedigree with serialization. The IPEC is calling for drug track and trace and stepped up customs enforcement in August of last year. And this past February, FDA held a well-attended workshop to brainstorm what a national track and trace system would look like. And just this past week, FDA was represented in person at the California Board of Pharmacy meeting in Sacramento to present the current ideas and possible approaches once again that were discussed at the February workshop. FDA has not, however, committed to any time frame or whether, in fact, they will take substantive action that would preclude the California law. The state of California and industry are both hoping that FDA will rationalize the requirements and eliminate proliferation of the different state laws. So nobody wants to have different rules across every state that you ship your products to or that you distribute your products in to have to comply with. It would certainly make sense to have a single set of rules at the federal level. In EMEA, several countries already require serial numbers on drug packs, and an EU-wide draft directive was ratified by the European health ministers this past June, which calls for tamper-evident packaging throughout the supply chain, serialization, and authentication of drug packs, at least at the point of dispensation. And the member states have 18 months from the finalization of the directive to draft their own laws. So we may see early movers coming online as early as middle of 2014, or more likely starting in 2015, which would coincidentally coincide with the California law. The industry consortium, FPIA, has already run a serialization and authentication pilot at pharmacies in Sweden to prove out the concept. Among notable developments in Asia are India, which jumped in with both feet with their announcement in January of this year that they would require industry to put GS1 standard serialized GTIN codes on 2D barcoded labels for all pharmaceutical exports. And that's actually a requirement currently in place. Several months later, the Ministry of Commerce extended the requirements to the domestic market, and those requirements go into effect in the first half of 2012. Drugs that fall on the list of 275 therapeutic classes identified by the Chinese government must be serialized by the end of this month. So China is also involved in trying to tighten up security on their drug supply chain as well. And in Latin America, Argentina announced earlier this year that they will be requiring serialized codes on drug package labels in 2012. I believe that's around the middle of 2012, joining Brazil in its evolving regulatory activities. Brazil is ramping up once again after considering feedback from industry, pulling back from their deadlines a couple of times, and reevaluating its approach. So Brazil does look like they're going to be moving forward with requirements in 2012. And most recently, I'm hearing of activity in Mexico. I don't have that on this slide. However, they are looking to secure their own drug supply chain, so we're looking to learn more there. But we expect to see serialization be a requirement in Mexico as well. So as you can see, there's a tremendous amount of activity driving change in the pharmaceutical industry around better tracking, tracing, and authentication of drug products. The approaches might differ in terms of how the data is managed, but the constant is that manufacturers will have to serialize their products at the packaging lines and be able to share that data in some form when the product ships. So there's also some potential business benefits to be realized by implementing serialization for products. So we see here on this slide the product flow going from manufacturer, distributor, and maybe multiple levels of distributors and wholesalers, eventually to the pharmacy and to the patient. But right now it's a one-way flow, not only of product but also of information. So the green here shows that with serialization and utilizing that data in track and trace systems or pedigree systems, there's an opportunity to make this a two-way conversation. And that two-way conversation holds the promise for improved reconciliation of what I call the 3 R's: returns, rebates, and reimbursements, identifying through better tracking of products, diversion and parallel trade, that really basically is gray market activity in most cases, so not necessarily legal in all cases, but is not the approved track for a product to its end destination. In some cases, it is illegal, though. So serialization will enable the better tracking of these products to fight these types of practices. And finally, as I mentioned, serialization should enable more targeted recalls, both to protect public health and safety and also to save manufacturers and industry overall time and revenue in not having to destroy product that was not impacted by the initiating recall event, be it a theft or some type of contamination. Okay, so I just want to spend a little bit of time as well on some of the drivers for the medical device industry around unique identification as well. So the medical device industry is looking to address a problem with product identification and tracking. Unlike pharmaceuticals, which are assigned a national drug code in the United States, there's no standard product coding for medical devices today. And this leads to a proliferation of codes to identify the same device as it moves through the supply chain. So obviously this makes tracking, billing, inventory management, recalls, product maintenance, and general communication about a device across supply chain partners very difficult and prone to errors. To address these concerns, an inclusion in the FDA Amendments Act called for establishment of a UDI system for medical devices, the key being a globally unique product identifier for all finished medical devices. And basically there are three things that manufacturers will have to do under the UDI regulation. Number one is create the code, create a unique product code, and also serialize the product if it currently requires serialization. Put that code on a device and submit your product data to the UDI database. And associated with that product data will be a number of attributes, and that number of attributes may grow over time. And those attributes essentially describe what the product is, describe the attributes of the product, its size, its content, its usage, and FDA says, you know, those attributes are subject to change, but today there's somewhere in the realm of between 30 and 40 of those attributes that need to be tracked. And there'll be three ways to submit the data to the UDI database. Number one is in bulk form via the HL7 structured SPL standard, which has been developed for drugs but is being modified for devices. Second is a web-based tool that FDA will provide. And the third is via a GS1 GDSN data pool. So data pools, if you're submitting your product data to a GS1 standard GDSN data pool, many of these data pools will be able to submit that data to the UDI database as well, so you don't have to do it directly. If you have a connection to the data pool may also provide that service. Essentially, the objective is to develop a system to identify medical devices which is consistent, unambiguous, standardized, provides a unique code at all levels of packaging, and is harmonized internationally. And with the goal of providing global visibility for and supporting these important functions. And I stress that the UDI database is intended to support these activities. FDA does not intend for it to be the system that performs these functions, but rather a source of product codes and attributes to other specialized systems or processes that will do these things, kind of like a product master database, if you will. So there's two main pieces of data that the UDI requirements call for. One is the static data, and that's the product identifier, which is basically the manufacturer, make, and model of the product. And that will be a globally unique product code for your finished medical device. And the main standards that are being proposed by industry and to industry for tracking these unique product codes are the GS1 GTIN and HIBIC codes, with GS1 kind of seeming to be in the lead right now. Associated with these product codes, as I mentioned, will be a specified set of product attributes. And this is the information that needs to be synced to the UDI database or the UDID. But another component of information that needs to be on the product label is the device identifier. And this is the dynamic data. And this is the lot and or serial number, depending on how the device is controlled today. So the UDI regulation is not requiring serialization where serialization is not currently required. But if you serialize, you need to have a unique and standardized way to track your serial codes. And that's one of the things that we're providing with our application as a means to serialize your products and manage that information at an enterprise level. Those device identifiers need to be unique to each product code. And as I previously mentioned as well, they're unique on all levels of packaging. And here we have a diagram of a linear barcode as well as a 2D barcode. And those application identifiers that could be required on your product, your medical device label. So the product identifier, expiration date, the batch, or sometimes called a lot number, as well as a serial number if serial numbers are required for your products. So this chart presents the current medical device UDI regulations globally and their rollout timing. The timing of the FDA regulation is the draft release is expected before the end of this year, according to Jay Crowley at FDA. It was planned for November, but the current plan is now to get it out before Christmas. With that, assuming that, the final rule is estimated by fall of 2012 after it's been open for comments during a comment period and a response period. And essentially what they're trying to do is have, assuming the final rule comes out in fall of 2012, then 1 year after the final rule, and that would put it out in fall of 2013, Class 3, or implants, medical devices, would have to comply. And 2 years after the final rule, putting it at 2014, the UDI requirement would be applied to Class 2 devices or equipment. And 5 years after the final rule, which would put it out at fall of 2018, the rule would apply to Class 1 devices or disposables. So just to recap, thieves and counterfeiters have big incentives to do what they do because they manufacture these fake products without all of the controls and expense that a legitimate manufacturer has to have in place. And these are often well-supported multi-million-dollar or even billion-dollar businesses. The risks that they impose on public health and safety are often impossible to detect without detailed analysis of the products that they peddle. Although virtually identical visually, the illegitimate products come with no assurance that they've been manufactured or stored according to common good manufacturing practices, that they contain the correct potency of active ingredient, that they function properly, and product serialization provides a means to supply chain partners and the end consumer to verify the authenticity of the products they hold. Each counterfeit hurts a company's valuable brand, and putting unique IDs on product packages will make it more difficult for the counterfeiters to pass their products off as legitimate, and will help cut down on the problem, providing a way to verify a product's authenticity by checking the ID against a trusted database and protecting brand integrity and public safety by enabling more targeted product recalls. The ability to better track products through the supply chain and more easily verify their authenticity will help maintain channel integrity by enabling actions to cut down on product diversion and parallel trade, which also impacts the company's profits by diverting profits of sales in higher price markets from the brand owner to the parallel traders. And we're also hearing from our customers that they see significant potential for possibly reducing revenue leakage through better scrutiny of chargeback rebate requests at the serial level. And from a returns reconciliation perspective, pharmaceutical companies write off an estimated $2 billion a year plus annually in returned products. And some of those are likely to be counterfeit from the wrong customer or otherwise invalid, but they have virtually no way to differentiate from invalid returned product with only lot level data. Additionally, serialization will allow reconciliation of warranty claims to better identify product when it's returned that it's your product and not a product that was illegally or covertly inserted into the supply chain and then returned back to you under the guise of it being a product that you sold. So there are a number of business drivers, a number of regulatory drivers that I've reviewed here, number of drivers that are pushing industry towards serialization. So I'll briefly introduce Oracle's solution for serialization and pedigree management that we've introduced. And it's called Oracle Pedigree and Serialization Manager, or OPSM. It's an application from Oracle designed to address your serialization needs. We call it an edge application because it's designed to be integrated with one or more existing ERP, warehouse management, packaging execution systems, or other online transaction processing systems by means of utilizing the built-in service-oriented architecture of the Oracle Fusion middleware, the included web services that come with the product, and the Fusion application development framework upon which it's built. So regardless of whether you currently run the Oracle eBusiness Suite, JD Edwards, SAP, or have a heterogeneous combination of multiple ERP systems, OPSM can coexist and integrate with them all to manage your serialization processes at an enterprise level. If you are, however, an Oracle eBusiness Suite customer, a bonus is that integration is productized with the eBusiness Suite and is available currently. And because it runs alongside your existing ERP system or systems, OPSM can be installed with minimal impact on these systems, which is especially important in validated environments. And it will keep the massive new serialized data burden from impacting ongoing performance of these systems. OPSM is designed to associate serial data with the lot level data that you manage in your existing systems that you run. It's important to note that OPSM delivers serialization and pedigree management in a single business application, complete with a friendly user interface and analytics that are built in. OPSM is unique in the sense that it's not only supports standards capabilities, but it also supports the generation of electronic pedigrees and built with users in mind, supporting the business functions to set up, manage, access, and analyze the data with pre-built screens and reports. And finally, you can install and manage OPSM internally or in the Oracle Cloud or in an environment hosted by one of our partners. So you have the flexibility in the management of this data. So just to give you an idea of how OPSM interacts with various business processes and systems, its interactions with transaction systems are at three main points: before and at the end of packaging, at shipping, and at receiving or returns processing. And looking at this graphic, we can see where OPSM fits in the overall business process. First, it's able to receive inbound ID codes from outside sources. Although a primary capability of OPSM is to generate these codes itself, there are situations where a company may want to get the codes from a third-party label provider that they contract with to create the codes and pre-print them on labels. And also in certain countries like Italy and possibly soon in Brazil, the government issues the codes to industry. So we need to be able to import them into OPSM. And next we have interactions that are numbered here 2 and 3 between OPSM and the packaging and labeling systems. And this is where packaging and labeling operations systems come into play. And this is a two-way communication whereby OPSM provides serial codes to those systems and product yield information is sent back to OPSM. And when shipping occurs, the serial data can be exported from OPSM to one or more of the receiving destinations in interaction number 4. And these destinations can be downstream trading partners who need pedigrees and or other external government or industry databases set up to track and authenticate these products. And finally, return serials can be reconciled against the OPSM data to verify their authenticity. Checks performed for return transactions include verifications that the serials exist in OPSM, that they're not flagged as counterfeit or suspect counterfeit, that they aren't expired, and that they actually previously shipped. In a future OPSM release, we'll bring a secure web portal and smartphone access mechanism for external customers and possibly even end consumers to query the serial data store to verify the authenticity of the products that they have in hand. And we're also integrating it with Oracle's EPC solution, which will provide additional standards-based event management and secure query and capture interfaces to enable product visibility across your supply chain. So if you want some more information on OPSM, you can go to one of these sites. The one on the top has a lot of information, including product demos, as well as collateral, and places to go, people to contact if you have questions or just want to get some more information for your company. And if you forget these websites, you can always go to oracle.com and just search on Pedigree, and the first listing should bring you right to the main Oracle Pedigree page. So now I'll hand it over to Jim Kerr from US Data Management to give you some information on USDM's Validation Accelerator Pack offerings and to go into a little more depth on the OPSM product. Jim?
All right, thanks, John. Appreciate it. Well, good afternoon or even good morning for some folks. So yes, as John said, I'm going to do two things. I'm going to talk about now validating your potential implementation of a tool like this, and I'll go into a little bit more detail, show you some screenshots of some examples. So one of the things that we as a company offer at USDM are what are called Validation Accelerator Packs, and they're basically a group of documents and other content that will help you realize cost savings when you're implementing your particular application. And we have application-specific accelerator packs for a series of different applications. They're done in a consistent manner, and a lot of we've used them a lot. We've used them for over 10 years now, and the graph that you see on the right is a summary of some of the findings that we have found over the years. That kind of shows the amount of savings that you can realize if you use accelerators like these. So as I mentioned, it is a group of documents that are required for validation, in addition to other application-specific content. So there are things like a validation plan, like a quality plan, a traceability matrix. All of our accelerator packs are based on GAMP, or the latest in GAMP 5, or Good Automated Manufacturing Processes. And we have a whole series of validation accelerator packs available for the product in the world of Oracle, in the applications that you see there: Agile, JD Edwards, the eBusiness Suite, Siebel, Learning Management. But we also go into other products, as you can see, even including PeopleSoft and AERS, et cetera. So they're meant to cover applications that span the entire pharmaceutical value chain. And here is a little closer look at what is contained in a typical accelerator pack. And we will be releasing soon some content specific for OPSM. Our Oracle Validation Accelerator Pack for the eBusiness Suite is available and has been available for quite some time, and it covers the areas that are of concern and of need for folks in this industry. So things like discrete manufacturing, process manufacturing, the MES offerings that Oracle now has, inventory, quality, et cetera. One thing to note about our accelerator packs is that these documents and the content within are all fully traceable, as is, of course, a requirement when you validate your system. You must be able to demonstrate how you met each of your user requirements. And so our accelerator packs will do this not only for the eBusiness Suite, but also for this OPSM application. Now, one of the other things that we do is we do business process analysis and mapping for your organization, and this helps your organization understand and make decisions on where and also why you may choose to use electronic records and signatures, but they're also for a variety of other valuable reasons. And what I thought I would show you here is, here is a typical process for a finished goods supply chain network where an organization is serializing their product. And so I'm also going to show you some screenshots here of what John mentioned earlier, which is the integration of OPSM that is built in and is available today for those folks who do have the bonus, if you will, of already using the Oracle eBusiness Suite for some of these. Now this process map here just shows a typical example of a brand owner and different entities. You might be using different packagers. So we have simply packager A and packager B and a third party logistics company. So in essence, jobs are released. And when they are released, or shortly before, is when the serials are issued. Then the job is packaged and completed. Serials are reconciled in the process of when you verify the batch record. Lots are released. They're shipped to the distribution center. And all of this time, the chain of custody, if you will, is all being recorded. And so these serials are being moved along as the product moves through the supply chain. Once they're received and stocked, and the aggregation may occur, serials are verified, and then when they're finally shipped to customers, if you have a need to report your serials in the European Union, or if you're U.S., this is where the pedigree is generated. So this is at a high level what the process may look like. But as John mentioned earlier, this does not have to all occur in one single ERP system. You may have the eBusiness Suite. You may have different packaging applications. You may have a heterogeneous solution of J.D. Edwards and Oracle and EBS and SAP. So it can work with really any combination, if you will, of whatever your ERP or packaging software may be. So this walks you through in a little bit more detail, and what this will do is this is going to align with some of the screenshot that I'm going to show you here now. So we're going to walk through this whole process from the creation or the generation of serials, the commissioning of them, scrapping if needed, the aggregation during a typical packing, all the way through shipping and the reporting, and then of course transmitting the chain of custody information or pedigree information. So here, and if you are someone who's familiar with the eBusiness Suite, I think you can see here this is your typical batch, and this is a packaging batch order. And here is where the OPSM application can then be launched. And kind of in the background here, it initiates the generation of the serial numbers in OPSM. And they are then, of course, commissioned. And here is what a screen looks like here. So here you can see the components that were packaged on this job, and then the serial numbers associated with each component, or with each item. If need be, as components or products get scrapped along the way after the job, you can also, of course, scrap certain serials that are not getting used. It also, and as John had mentioned before, what you see here is a user-friendly user interface that users can interact with. And here is the case where, if you're in a warehouse process where the packing and the aggregation can occur, and then so you can see, if you unpack and repack as part of your process, the serials, the chain of custody of those serials are maintained throughout. And then this is a screenshot of the typical ship confirm transaction in EBS, and you can see by launching the tools menu, again, the integration to OPSM for shipment. And typically here is the place where you can generate your pedigree, and it's available in either a human readable form or it's also available in XML so that they can be transmitted to wherever it needs to be transmitted to, either in your supply chain or to whatever agency needs to receive it. It also has the ability to perform queries on transactions so you can look up any historical information that you may need. So that's all. That's what we have for today. I want to thank everyone for joining our call. I know there's a lot of good information in here. So at this point in time, we would like to I'm going to turn it over to Becky and open it up for questions.
Thank you so much, Jim, and thank you, John. Great information presented. I really appreciate you guys sharing that information. Our first today is from Aditya. Question, I believe, is for John. It says, I'm seeking GS1 standard as increasingly important across many global requirements. Can you talk about how your solution can help me comply with these standards?
Sure. Yeah, we recognize that supply chain security depends on industry-wide adoption of data standards and collaboration around those standards to share that data among the trading partners and across the applications that deal with this data within your enterprise. So openness and interoperability have been design tenets of the OPSM solution from its inception. So we've made sure to conform to GS1 standards throughout by building in support for product identification in the GTIN. One of the codes which we use to identify locations is the GLN, or the global location number. We support serial generation in various configurations that you can specify, including serialized GTINs, both SGTIN 96 and 198. And currently OPSM can transmit serial data at the time of shipment in an EPCIS shipment business step standard format. And as I mentioned, moving forward, we'll be doing more work integrating OPSM with Oracle's EPC solution in the background to serve as an EPC data store, as well as a solution to provide EPCIS services. I hope that answers your question.
Thank you very much, John. Let's see, our next question is from Frank. It says, would I need to validate OPSM?
Yeah, I think I'll take that one. This is Jim here. Well, yes, you certainly would, and I think one of the nice advantages of it, John had mentioned this earlier, in the way that OPSM is offered. It is offered as a standalone application, if you will, and so it can really be added as an application running on the side, so to speak. And as a result of that, it not only does not interfere from a performance standpoint, but it's very minimally invasive to what you're doing in ERP. So, of course, you do need to validate it, but what's nice about the way it's been presented is the burden of validation is definitely significantly decreased, and that, along with the use of an accelerator pack like the one that we offer, there's definitely a very strong, compelling message here, so that the validation can be done in a least cost compliance way as possible.
Very good, Jim. Thank you very much. We do appreciate that so many of you took the time to attend today's presentation, and we will need to address the rest of the questions offline. As I see, we've run quite a bit over. Thank you all for sticking with us for this good information here. We do encourage you to join the discussion on LinkedIn and visit our website to review topics for upcoming webinar events across the USDM practices. If you've appreciated the information shared, please do let us know by clicking the like on our USDM Facebook page or the discussion. You can join the discussion there on our LinkedIn group. Excuse me. On behalf of the Oracle and US Data Management team, we do appreciate the opportunity to team with you towards excellence in compliance. Thanks again and have a wonderful day.